You will begin your USP 797 garbing process by first stepping on the tacky mat and placing on your booties one at a time. This can also be done on a clean bench. Gentlemen would first put on their beard covers, followed by the bouffant. Ladies will proceed with their bouffant first, followed by safety glasses and your face mask. You tie your face mask, tying the top two strings the lowest, and your bottom two strings should be tied at the top. Once you have secured your face mask in its appropriate position on your face, do a final mirror check and begin to wash your hands. Once your water temperature is appropriate, first rinse from fingertips to your elbow on both arms. Then use your soap and lather from your fingertips to your forearm on both arms. Always being mindful of washing for at least 30 seconds. Make sure you wash the fingertips as well as underneath your nails. And once you have completely lathered, then you will rinse from your fingertips to your forearms on both arms. After your final rinsing, allow the water to drip from your fingertips to your elbows over the sink, and grab your lint-free cloth, or in our case a paper towel, and pat your fingertips and in between your fingers dry, as well as your wrist and your arm. When you have completed your hand washing procedure, proceed to turn off your faucet with a paper towel. Then gather your gown and inspect it for any defects or tears. Don your gown and ensure full enclosure. This is easiest by securing your middle tie first and then proceeding with your top tie. Next, you sanitize your hands with a 75% IPA gel solution. And allow your hands to dry thoroughly. Next, gather your appropriate size gloves. And as you don your gloves, make sure that the end of your gloves covers the knit cuff of your gown. Inspect your gloves for any holes, tears, or defects in appropriate size, and then proceed to disinfect them with the waterless alcohol-based solution. Then you may proceed with your aseptic technique. We will simulate today's laboratory activity in the horizontal clean hood, meaning that your airflow is coming directly at you. Take a lint-free hood wipe and fold it in quarters. First, using the sodium hypochlorite or bleach solution, go ahead and saturate your cloth. Beginning with the part of the hood closest to your filter, you will clean close to the filter first at the top and then move outward towards you. Now, using a new side of your cloth, you will clean the IV bar. Now, using a third quarter of your cloth, you will clean one of your sides, starting from the side closest to the filter and moving out toward you. Still using the sodium hypochlorite solution, you are now cleaning your second side of the horizontal hood. Again, from the inside out, because of the direction of your airflow. Lastly, you will clean your hood bench from the side closest to the filter to outside towards you. Always clean, cleanest to dirtiest. and making sure that your head stays out of the hood at all times. Next, you will repeat all of those processes with the sterile IPA. So you will spray your lint-free cloth outside of the hood, get it nice and wet, and begin back at the top with the side closest to your filter. Using a new quarter of your cloth, you'll clean your IV bars with the 70% sterile IPA. Still saturating the cloth with the 70% sterile IPA, you'll clean the opposite side from the side closest to the filter out toward you. And lastly, you will clean the bench of the hood with the 70% sterile IPA. Always in a direction away from the filter. Now, before proceeding with today's laboratory exercise, you will make sure that you disinfect each item before placing it into the hood. You can either do this with a saturated lint-free cloth of IPA or alcohol wipe. You'll begin with your 5% dextrose 50 ml bag or your 0.9% sodium chloride for injection 50 ml bag. You will also need a sterile powdered medication vial, which will simulate the ceftriaxone for today's lab. One 10 ml vial of sterile water for injection. You will need two 18 gauge by 1 inch or 20 gauge by 1 inch needles. Again, this is my second needle. One vented needle. A correction has been made for your lab. You will use a 10 ml sterile syringe. And an IV seal. To minimize contaminating your hood with dirty air, place your alcohol wipes on the outer sides of your hood within that 6-inch portion that you've been asked not to compound in. You are going to open the vials of your powder medication vial and your sterile water and disinfect them using an alcohol wipe with one swipe. Once you have completed this task, remove all trash to the sides within that 6-inch portion of the hood. While allowing the vials to dry, assemble your 10 ml syringe with either your 18 gauge or 20 gauge needle. Gently peel open the packaging on your syringe about halfway. Leave it in its wrapper and go ahead and peel back the packaging on your needle and apply your needle or attach your needle to the syringe. Once it is secure, you're going to move your trash to the side. Make sure the plunger on your needle is working. Remove its cap from the needle. Draw back to the appropriate volume of air. Inject your air into your sterile water vial. And draw back your appropriate volume. Once you have successfully removed your air bubbles, you will recap the needle on your syringe and then detach the either 18 or 20 gauge needle from your syringe and apply a vented needle. Using the vented needle, you will pierce the rubber stopper of your powder medication vial and reconstitute the sterile powder with your sterile water for injection. You do not have to add air to this vial because the vented needle does it for you. Once you have injected that vial completely with the appropriate volume, you would detach the vented needle from your 10 ml syringe and apply your second 18 gauge or 20 gauge by 1 inch needle. Here you are gently agitating your powdered vial by rubbing it in between your hands gently until it is fully in solution. I am just inverting the vial to make sure that everything is in solution, and if not, I know to continue to agitate. Once your powder is fully in solution, you are going to withdraw the appropriate calculated volume to clarify the appropriate reconstituted volume from your vial. Be mindful of the calibration marks on your syringe. Remove all of your air bubbles. Recap your needle. And proceed to swab the additive port of your mini bag with a sterile alcohol wipe. Now you are going to inject the appropriate volume into your mini bag according to your prescription order. Make sure your bag is appropriately mixed. Recap your needle. Pull back your syringe to the injected volume and leave it for checking by your instructor. Apply the IV seal to your additive port